The diseases and disorders of TMJ are divided into following categories. First of all, there are myofacial pain disorders, the congenital, and the developmental disorders, such as condylar agenesis, hypoplasia, and hyperplasia. Then there are displacement disorders, which can be with reduction or without reduction. TMJ arthritis, which can be either osteoarthritis or rheumatoid arthritis. Then comes TMJ ankylosis. Ankylosis can be intracapsular or the extracapsular. TMJ dislocation, traumatic injury to the condyle, and the neoplasms of the TMJ. So these were the diseases that can occur in the temporomandibular joint, but in this specific video, I will only be discussing myofacial pain disorders, which are said to be a common cause of mastication pain, and they also limit the function of mastication. Myofacial pain disorders can be unilateral, with dull itching pain on mastication, and pain increases with muscular use. So the patients of myofacial pain disorders have following complaints, which are mostly associated with referred pain, such as headache, otalgia, tinnitus, tongue burning, and sometimes decreased hearing. So most of the myofacial pain disorders occur due to overuse of the muscles. There are some habits behind that, such as bruxism, clenching, and even excessive gum chewing, leading to muscle spasms and fatigue and subsequently pain. So the myofacial pain disorders are divided into 6 categories. First of all, it's myositis, which clinically presents as acute inflammation and pain. Edema and decreased ROM. Myositis can be due to overuse of the muscles, infection, or trauma. So the treatment options for the myositis are: just ask the patient to take rest, use of non-steroidal anti-inflammatory drugs, and antibiotics also can be used as needed. Another type of myofacial pain disorder is muscle spasm, which usually occurs due to acute contraction from overuse of the muscles. And the treatment options for the muscle spasm are massage, heat, muscle relaxants, non-steroidal anti-inflammatory drugs, and it is also important to ask the patient to take the rest. Third type of myofacial pain disorder is the contracture, which is basically the end stage of untreated muscle spasm. Contracture occurs due to fibrosis of muscles and the connective tissue. Treatment options for the contracture are non-steroidal anti-inflammatory drugs, massage, and the vigorous physical therapy. And sometimes we can also go for surgical release of the scar tissue. So the fourth type of myofacial pain disorder is the pterygal trismus, which are characterized by decreased ROM, and it is said to have a psychological etiology. It is more common in females. The fibromyalgia is the fifth type of myofacial pain disorders. It is characterized by diffuse systemic process, with firm painful bands known as trigger points, usually seen in weight-bearing muscles. It is often associated with sleep disturbance. It is more common in females. So the diagnosis criteria for the fibromyalgia is through trigger points, known path of pain for trigger points, and the reproducibility. So the sixth and the last category of myofascial pain disorder is the collagen vascular disorders, which includes Sjogren's syndrome. Sjogren's syndrome is the autoimmune condition characterized by xerostomia, xerophthalmia with keratitis. Sometimes muscle and joint pain is present, including TMJ. Sjogren's syndrome is diagnosed with minor salivary gland biopsy. Another type of collagen vascular disorders is the systemic lupus erythematosus, which is also an autoimmune disorder characterized by butterfly rash, fever, rheumatoid arthritis, and it is diagnosed with high ESR, positive ANA, and the false positive VDRL. The third type of collagen vascular disorder is the scleroderma. It is also an autoimmune disorder with gradual muscle and joint pain, tightening of skin, and limited jaw expansion with pain. So from diseases and disorders of TMJ, I have discussed the myofascial pain disorders in this video. I will be making separate videos for all the diseases and disorders of the TMJ. Make sure to subscribe for more dentistry related lectures like these. Also, if you guys have any questions regarding this, leave them in the comment section. You can also follow me on Instagram and Facebook at SmartK3Dentistry. Thank you for watching and see you in the next video.